With me now is lecturer and program coordinator Cynthia Boles and one of her students, Corey Wilde. Thank you both for being here.
Thank you.
Thank you.
So Cynthia, when we say medical assisting, I think especially with the way you guys are dressed, a lot of people think you're a nurse or
Yes.
you're something like that. So explain to people what medical assisting is.
You are exactly right. That's such a misconception. And in my opinion, I do believe that a medical assistant is much more versatile, more valuable. Nurses have excellent clinical skills, but the medical assistant could also work front office and work in the laboratory, which is definitely more than a nurse generally does on a day-to-day basis. So we have our students learn how to draw blood, process specimens, do CLIA wave testing. We also do scheduling, vital signs, big important role too.
Okay, so sometimes when you go to the doctor, you think it's a nurse that you're dealing with, but it's actually a medical assistant, correct?
Yes.
Okay. So, Corey, tell me why you decided to pursue this degree.
I decided to pursue this degree because I have been a patient numerous times in my life, and I have seen how a medical team can work well and how they cannot. So I wanted to bring an exemplary personage to a place in a medical office that said, I'm here to help you. I'm not here just to, do my job and walk away. I actually want to make you get better and better yourself.
So, Cynthia, is that something you talk about in classes about that being a people person type of?
When we do Introduction to Medical Assisting, the first class, that's generally the basis for that class is professionalism, communication, using critical thinking skills so that you can see what needs to be done with that patient to make them feel better.
Now, that's something you think is your strong suit?
Yeah, I actually like to be able to relate to the people, know what they're going through. Explain to them that, look, I've been in your situation and it's going to be all right. Not necessarily is this, I'm not saying I'm not a doctor. I'm not here to work outside of my scope of practice. But I know how you've felt in this situation, so I can bring a little more personability to it, make it a real life situation and say, hey, I've been here and it's going to be okay.